My name is Roger Mason, and I'm the CEO of the Genie. We're based in Arkansas. I'm a surgeon, but I've also worked in a number of other disciplines. I've done extensive work in emergency medicine and as a hospitalist, so I've seen medicine from different perspectives. I was trained at a time when the physician sat with a patient and took a very careful history and physical, and at the end of that time they had a pretty good idea, and I still do when I engage with patients, what's going on with the patient. The Genie is a software diagnostic tool. Our technology will eliminate a tremendous amount of excessive testing that is being done in the United States and other countries. We're capturing the intellectual thought process of what we're calling a master diagnostician as they interact with the patient and take a history and physical. And then this is fed into the computer, which collates the data, and using access to the World Fund of Medical Knowledge will come up with a diagnosis that fits that patient's symptoms. I spent 8 years recently down in Trinidad and Tobago, and I was working with the indigent population there when I was recruited back into the United States back in 2010 to work in this hospital I'm working in Arkansas. To my amazement, I found out in the Arkansas Delta, it's one of the most medically underserved and economically challenged regions in the whole country, very similar to the experience I just had in the emerging nations of the Caribbean. So some of the techniques, strategies, and tools I had developed to improve their healthcare system, I was able to translate into a domestic healthcare program. And the Genie is really the focal point of that activity. It fills the void to some extent of the growing shortage of primary care docs that we're being faced with today. It's going to allow lower level trained healthcare providers to act in a very competent way to obtain a history and physical. It's going to be like your personal trainer or your personal valet who is guiding you to a better state of health. So that's what makes it exciting, is it's going to enhance the ability of all clinicians and indeed the individual layperson to understand more about their health.